on a YouTube after this presentation. And without any further ado, I think we have in the session Alexandre. Lourenço, can you turn on your video, please, and join us? Okay. Alexandre, Lourenço, good morning.
Morning or good afternoon.
Good morning, and welcome everybody. So without any further ado, I think we have still to apologize the inconvenience of Mrs. Eva Carbonier, Mrs. Ioana-Maria Gligor are not able to join us. The times are very difficult in Sweden, as we could also, Gerard Bourbon, our guest, will going to explain. But let me just do a formal presentation of our session, and I will show my screen in just a few minutes here so that everybody can see my screen and my presentation. So welcome to the Lunchtime Talk, COVID-19, Europe, What Now? It's really a pleasure to have you all here and in this very brief lunchtime talk, as I know agendas are difficult and your time is precious these days. So this is a preliminary lunchtime talk series for the Altata Forum that I hope to have all of you next week in online summit. It was to be in Cascais, but unfortunately the COVID is forcing us to go on a virtual format. I'm very pleased to announce our major partner Glint and our founding partners for making these initiatives possible. And also to introduce myself to the ones that don't know, my name is Paulo Nunes Dia. It's Paulo Nunes de Abreu in Português. I'm a certified professional facilitator and I'm your moderator today. As obviously all the participants are already following these instructions, and I thank you all for these. Please turn your mute and video off. And if you wish, please use the chat to, first of all, introduce yourself if you like, and also to ask questions to our interviewees this morning, if you wish. Use the chat function on Zoom. So with us today is Alexandre Lourenço, is the president of the Association of Hospital Administrators. Is also the vice president in the European Association of this same professional body. And it's a pleasure to having us here with us. Ioana-Maria Gligor, as I said, has apologized not being able to join us today, as she was expected to be here, but he will be on the next week on our online summit next week. Patricia Calado, it's a pleasure also to having her here with us today, a board member of the National Agency of Medicine, of Clinical Research and Biomedical Innovation, and also it's the national contact point of the Horizon 2020 program. Welcome. And as always with us, I think Gerard, I missed your slide here, I'm so sorry, but Gerard Bourbon, I will fix that in a minute, is also a guest speaker whoops. I think Gerard Bourbon is our guest speaker also in the event. I'm sorry, Gerard, that your slide is missing here, but I'm going to do is to...
Not to worry.
Okay, I'll do a ribbon presentation in the end. And as always, Albert Campos Fernandes, former Minister of Healthcare, and also currently a professor at Escola Nacional de Saúde Pública, University of Lisbon. Without further ado, so I will ask the participants here to start the intervention, maybe by giving the words to Gerard Bourbon from Sweden to give us a little perspective on Europe. What now, in your impression, Gerard?
Okay, let me just make sure you can hear me all right, right? Well, my impression is that obviously what we are going through is unprecedented. It's not something that the majority of the countries in Europe were sort of well prepared for, but of course, different countries are reacting differently to how the situation has developed. I wish here in Sweden we would have done what you have done in Portugal or Spain and other countries, and have a more, I will say, strict lockdown when it comes to people, rather than just guidelines. Because I will say here the situation in Sweden has been, in my opinion, a bit of a disaster. We were not prepared. The government was not well prepared, and we have had the same shortages as everyone else. On PPE, on ICU beds, and staff and resource. And the problem that we have here in Sweden is that the health authority in the government doesn't have the mandate to basically force people to be locked down. So they decided to basically have guidelines that people somewhat followed. And I will say the majority of people have been acting responsible. The problem we've seen is that there are many people that ignored the guidelines, because at the beginning the communication was loose and vague. As you remember, in the UK, we took the same path, and we took the same path as the Netherlands, where the government was dismissing the approach, and saying, well, this is sort of a little bit harsher than the normal flu. They made comments that we will never reach more than 20 people infected. Then it was 100. Now we are where we are, right? Where we have the highest death toll per million anywhere in the world. And the secondary effect of the herd immunity sort of goal that we had, it's never going to be reached, right? And then of course you have the different ever-changing new things that we're finding about the virus and how it's affecting people in a different way that is sort of creating havoc. Swedes as a whole, it's a pretty homogeneous society, and they follow the law and they follow the rules. So I would imagine that if the actual government made the communication clearer and better, we will be in a much better position. But since they were merely guidelines, many people ignored them, and we're paying the price. So I honestly think that we did better, and that we were more like the rest of Europe.
Mm-hmm. Thank you so much, Gerard. I now would like to ask the comments of Alexandre Lourenço in breaking here a very important code of ethic, which is normally ladies first. In terms of Patricia, Calado, I would beg a comprehension for this. But Alexandre Lourenço is someone that has been involved in a very important tool that was used by the World Health Organization and was conducted to help decision-making concerning this crisis. Alexandre, can you expand a little bit on this effort that you have been doing, and also how you see that Europe can be doing something useful after this crisis?
Regarding, I just hope that my connection is good. If it is not, I will try to improve it. But I'm anyway. Excuse me if it's not so well. So first of all, what we have been doing, and actually not only as a consultant, but actually the Portuguese Association of Hospital Managers, we started to work closely with the task force that is dealing with the COVID, mostly at the surge of resources for COVID. So we developed with also the Portuguese company Glint surge planning tool that is now being used across the world on helping countries developing the surging planning regarding hospital beds, mostly also considering different levels of severity for moderate cases, for severe cases and acute cases, but what we call ventilators, but also for ECMO and renal replacement therapy. and also the human resources that go with it. So this planning tool is being used. We are improving it continuously together, and in that sense, it has been a great a pleasure to work on this important topic. Anyway, what we are now working on, it's not only on the search planning, it's on the transition phase that we need to go further on, not only to plan the resources that we need for the first wave, but now how to conciliate the response to COVID-19 and also for the other and general healthcare. But let me just focus, please, and what I believe that Europe can deal with the COVID, and at least an overview from my side what I believe that we can do at European level and what have been done in the last or during the current crisis. First of all, we realize that this is an health and sanitary crisis, and in my opinion, most of the tools that we have at European level, they weren't sufficient. Even in one of the devices that we developed for epidemiological surveillance, that is ECDC, we show that even across Europe we have different policies regarding epidemiological surveillance. And even if you consider the protection of the overall Portuguese, I don't know if someone is with a mic connected making some noise.
We can ask our dear participants to please unmute yourselves, and otherwise we cannot progress in the conversation.
But anyway, at this health issue or sanitary issue, even the mechanisms that we have at the European Union level, they didn't work. So ECDC didn't show and at least convince the countries how to develop epidemiological surveillance. Each country is developing by its own, and even though some recommendations are being followed by member states, ECDC and with the Commission are not having a common surveillance policy across Europe. Even when you consider recommendations, you have seen the case of Sweden, and of course countries have their own own policies. Even in the implementation of policies, in the case of Sweden or Denmark or Netherlands, actually each country developed their own approach, and we didn't have a common approach to COVID-19. Actually, we even had some selfish behavior, some countries that are producers of PPEs, personal protection equipments, and ventilators like France or Germany, that first of all, they stopped exports from their own countries to other countries that were in need, just to comply with their own needs and not considering the common good or the common European goal. The other issue, and actually even though health is not a common policy, we really didn't show how to do it. Even if you had some good examples, for example, in critical situations where, for example, patients that needed mechanical ventilation, they have been also treated in Germany. So we had seen these small anecdotal examples that show us that there is some goodwill from member states, but at the general view, I think that each country was by themselves. So in my opinion, we really miss the issue about common security of the European Union, European state. We didn't approach this pandemic as also a security issue for Europe, and that was missing from the European policies. The other issue is that actually we also, and we will see in the future, how we are going to see the economic impact of all this non-European integration at this pandemic level. So we are now more concerned with the downturn of the economy, the European economy, and what will be the measures to deal with the economic issue. But actually, previously, we could avoid this economic impact, and that is occurring mostly because we didn't have a common health policy and a common security policy regarding health. So, in my opinion, and I think that's what we need to discuss further on, is how we can integrate Europe at health policy level more. And I think during this virtual meeting, we can do this discussion.
Absolutely.
How we can really integrate more at European level.
Absolutely, Alexandre. Thank you so much for the presentation. I think we have now Ioana Gligor is in. She just lost her in this intervention. Oh, she's back. Hello, Ioana. Welcome. We are not able to hear you. Okay.
Yes, I unmuted myself. Yes.
Okay.
Yes. Thank you very much for inviting me to this discussion, and I look forward to the very interesting debate. Yes.
Yes, the question is definitely, as the presentation of Alexandre Lourenço just showed, is have you got the feeling that at EU we can now have a further, more decisive role in the recovery? And how could that be in terms of making the healthcare systems in Europe organized as a one?
May I make a comment on that front?
Yes, this was for Ioana Gligor.
Oh,
Gerard, can you hold that for a minute?
Sure, no worries.
Well, I think we cannot, even with the crisis, we cannot really change the treaties. So the Article 168 of the treaty says that health is a national competence, and the European Union is supporting the health authorities in this. And this is what we are trying to do, either with, for instance, the joint procurement, with supporting, steering the debate at different levels with the and working very closely with the member states. And I would just like to give you the example of the e-health network. I was counting today with in my folders, we had 11 meetings with them since the 25th of March. Normally we have 2 meetings per year, but it has been a very, very active period in which we worked very strongly with them on the toolbox for the apps, for the tracing apps. And we are trying to support as much as we can the member states in building this common approach and making sure that even if we cannot build a European health policy, because the treaty is quite clear on that, we are trying to build as much convergence as we can. On the other hand, we are also working with member states in several workshops on the European health data space, in looking what are the obstacles to the implementation of the GDPR and the use of data. And we hope that soon we'll also start the support for a code of conduct that, as you know, has to be developed by the organizations on the ground, and we will support this very closely. And also we'll try to support even more the setting up of a governance structure for the data spaces and for the European health data space, and building the right infrastructure in order to make sure that the data is better used, both by the researchers but also by the health authorities. Because what we have seen also now in this crisis is that the health authorities, they don't necessarily have the data that they would need in order to do the right analysis and to do the right decision makings. I think there is a lot of work going on. Our cycle in better regulation is not necessarily the speediest in the world, I must admit, in European Union, because we need to have strong proposals that take into account the views of all the stakeholders. So at EU level, We can't really make a law over the weekend, as it has happened in many member states. But what we try to do is to make sure that we are supporting the member states. We are building as much consensus as possible, and we are trying to support the member states to develop the policies in the right direction and to come up with a solid proposal, non-legislative, legislative, and to build the right infrastructure for supporting the better use of data to fight the crisis and to prevent what has happened in the current crisis.
Thank you so much, Ioana, because in the sense that was the effort of Alexandre. Gerard, I know that you have a comment to do. I please ask you to hold it because Patricia Calado has not intervened so far. And I think it's relevant that Patricia Calado can now join this important stage of the conversation because Europe has necessarily a role to play, Patricia. What is your opinion about this?
Thank you, Paulo. So my perspective is a bit different because I work on the research side. And on this front, there has been a lot of work done, coordinated by the DG Research and Innovation, always in collaboration with DG Sante. And I would like to follow Ioana here that it's not a light machine. So in order to take decisions, we need the views of all member states and other stakeholders. So it's a heavy process. I would like to summarize briefly what we have been doing from the research part in close collaboration with health, because the solutions to this pandemic will surely come from science. We need the vaccines, the therapies, to optimize the tests, to work on better epidemiology studies, whatever, it has to come from the science part. So after many meetings that started occurring, I don't know, still in February with all member states, I think, we have 3 different lines of action that we have been working on. First, very soon, still late January, very early February, the European Commission opened calls for new projects for responding to COVID-19 pandemic. These were different calls, either from more basic science, applied science, innovators, companies. Several hundred millions were invested on projects that are now already ongoing. Then more recently, following a meeting from research ministers on 7th of April, the European Commission proposed an action plan, Era versus Coronavirus Plan, with 10 actions that are short-term actions that will help facing the most pressing issues. So we have 10 priority actions that include focusing on coordination of funding, extending large EU clinical trials. This is very important because we are working in Europe in tests, vaccines and treatments, and we need to set up the clinical trial landscape so that we can, in a fast way, put tests ongoing without having to wait several weeks or months. I would like to highlight 2 actions of this action plan. One, the COVID-19 data platform that was launched last week. So European Commission in coordination with the European Bioinformatics Institute from EMBL and other partners like AICIB in order to share data sets. So this can be genomes, proteins, clinical data, preclinical data. There is a big request, and it's actually mandatory in all the funded projects in Horizon 2020 to share and give open access to data and results of this research with a focus on COVID-19, particularly now. And also in the last weekend from 24th to 26th April, we had a pan-European hackathon which mobilized thousands of innovators and the civil society from all over the world in order to create new solutions to respond to the COVID-19 pandemic, not only in the area of health, but only relating to business, social impacts, 5 different areas. So this was all set up in a very brief period of time. So basically we have hundreds of millions in calls that were already opened, closed, projects are ongoing. Number 2, the action plan with 10 priority short-term actions, which include collaboration, more funding, etc. And finally, Europe is taking the lead on, I don't know if you heard of this, on this pledging initiative that will start on May 4. That actually came from the World Health Organization and other partners, and then the European Union, the European Commission offered to take the lead on this. And the goal here is that we are able to not only, the research part is difficult, but we can do it, we have funding for that. The most difficult thing here is once we produce vaccines, treatments, and tests, to be sure that everybody in the world has access to these technologies. Because this is almost every country in the world is affected by COVID-19, so all solutions must be available globally for an affordable price. And this is the big challenge, I would say, as a society we have now. So this pledging initiative wants to gather 7.5 billion euros to invest in vaccines, therapies, and tests. And it has also the goal of having the political commitment from member states in order to assure equitable access to all these innovations around the world. Because underfinancing exists mainly for manufacturing, procurement, and deployment. This will be the big challenge once research and innovation bring us to the solutions. So the European Commission is also taking the lead on this international pledge. It's still work in progress, but the day for we start the rollout on May 4. And that would be my comment for the time.
Thank you so much, Patricia. It's so relevant and useful. Gerard, do you want to say your saved comment by all means, because we are trying to reserve the last part of the discussion in Portuguese, and also be reminded that in the next week in the Health Data Forum we have a lot more time for discussion. This is just a sample.
No, exactly. What I wanted to say though is that, I mean, all the initiatives that we are working on independently, it would be nice to coordinate and work across member states in a grander scale. I mean, at INL, for an example, we've been answering calls with the European Space Agency to monitor social distancing. We're making now tests, both antibody tests and normal tests, as well as a handheld sort of device that could be in people's homes. But what I would like to see more is a unified way of member states within the EU preparing for the next hit, because it's not a matter of if, but when we're going to get hit with a potentially more devastating wave or a new virus, right? I mean, if you look at what's happening in the Amazon and in China, the wet markets are opening again. In sub-Saharan Africa, I mean, we are encroaching more and more into the habitats of wildlife. And it's only a matter of time before a new virus comes along. And I mean, this is a warlike exercise that we need to prepare for with operations, logistics, and equipment, just like if it was a military exercise. So what I'd like to see is all these initiatives are fantastic from the different companies in the different, academia and research institutions and so on, but a unified front towards mitigating this potential next wave or the next virus. And not just leaving it at that, is more of a comment of thought, so that we all keep it in the back of our heads, that this should be a question that should be asked to the leaders, political leaders and country leaders in our individual countries. What are we going to do for the next one? How are we preparing?
Definitely, yes. And I see that Alexandre has raised a hand to do some intervention. Go ahead, Alexandre.
No, it was just to make a brief question, because we have also from the European Commission. One of the issues is that, of course, we don't have a common health policy, and the health policy is mostly driven by member states. But are we going to see, for example, but at the market level, we have a common policy. So are we going to see, for example, some fines or penalties to the countries that forbidden exports to other European members of ventilators, PPEs? It's a question.
We should.
Maybe it's a question that Professor Adalberto Campos Fernandes would like to answer.
Hello, thank you very much for this fantastic talk. Yes, I agree with Alexandre Lourenço in most of the statements that he produced, but I believe that the key words are now cooperation and collaboration, not only between academia, research, but also at the political level. We all know that the treaty does not allow that the European Commission takes a position in national health policies, but it is the moment, right? And Gerard de Bourbon gave a very interesting example, like a military exercise, because we are now globalized, but we are not coordinated. And this is the good moment to have some essays and some tries to prepare the new pandemic and the new epidemic phenomena, because you all know that COVID-19 is not the last of the virus that we have to face in our lives, but probably the next virus will be worse than this one. So collaboration, cooperation, and probably more commitment in ethical terms, because Europe is washing their hands all the time concerning the National Health Service and the national health policies. And the experience that Sweden has now, and at the beginning the United Kingdom has also, shows us that it is not only necessary to have nice people, nice cultural and educational level, nice health systems to commit some mistakes. And Sweden is a bad example now, but Austria and Germany are good examples. So it is necessary to build a collective idea in Europe that health systems and health delivering is key issue for the human development in Europe, and not to close the doors and close our minds with the classic excuse that the treaties say that the national health competencies must not be invaded by the European intervention. So I follow Alexandre, I follow Patricia. It is now the time to strengthen the efforts to prepare the new pandemic, to prepare the new threat, and we hope that in the next few years we'll be much more prepared with more investment and with more finance for investigation, but also for delivering of healthcare in all countries in Europe. Thank you very much.
Pleasure. Thank you so much. I see a question in the chat for Patricia Calado. Would you like to answer this?
Thank you, David. I think this is actually the focus of the process that the European Commission, particularly the DG Research and Innovation, is trying to conduct now. So open science, definitely data sharing, open results. This is mandatory for all projects that are funded by the European Commission. And also what we are trying to do now is to streamline all the development process. I can let you know that this ad hoc group was created, and we are working on 4 different levels: manufacturing, tests, financing, and I'm missing one. It doesn't matter. The thing is that we don't want to see all this process running subsequently, as you usually do when you develop health innovation. But we are trying to think in advance of the bottlenecks and trying to overlap the different stages as much as possible in order to overcome the bottlenecks and can have a really fast time to market, the shorten as possible. So this is the view of the European Commission. Also for this pledging event, many questions come up asking, people are asking for 7.5 billion euros. Who will take this money? And the information that we have so far is that it will be given for managing by platforms that are striving to get these vaccines and therapeutics open to everybody. So this is the view now. We are building and doing a very strong collaborative effort on this. this was all very recent, but this is the way that the European Commission, from the science, from the research part, it's trying to conduct the process open, and that no one is left behind.
Thank you so much, Patricia. I have a question for Ioana Gligor, maybe. Ioana, are you still able to put your video on, taking advantage that you are able to join us here, and maybe for a final comment, if you like to. Ioana?
Well, yes, I'm not. Yes, do you hear me?
I can hear you. I can hear you.
Okay. Do you see me as well?
No, I don't see. We don't see you. No, you have a video turned off.
Well, I don't know how to turn it. I'm trying, but it doesn't work apparently. Doesn't matter. So.
Okay. I will share you the screen slide with your picture. That's okay. But if you had a magical stick, Ioana, what was the wish that you ask right now?
That we would have already the initiative on the European health data space, and we would be able to pool the data together and also have the infrastructure already in place in order to make sure that both researchers and public authorities they could build and use basically quicker and faster the COVID registries, that ECDC and epidemiological institutions, they would have the data they would need related to the COVID patients, and they could do the right evaluations and the right or basically everything they would need in order to use the data for discovering new treatments and new therapies. I know that there are a lot of efforts at the level of AICIB, and this support has helped advance tremendously. But to be very honest, I think there is quite a lot of work that could be done, and we are trying to speed it up on the data space. And if I had a magic wand, I would like that this is already be done and would serve already this crisis. But I think we have already good arguments to speed up and to advance at even a quicker pace for the next step.
Okay, thank you so much, Ioana-Maria. And this is also a very useful reminder that the importance of the Health Data Forum next week, where we're going to address these questions in more depth. And now I would ask our esteemed guest speakers that we could change the session for Portuguese in the last minutes,
Okay.
if you don't mind.
Thank you very much. Yes.
And saying goodbye to Ioana-Maria and Gerard, and see you very soon next week in our online summit.
Thank you. Obrigado.
It's my pleasure.
Obrigada.
Thank you for your time and these very busy days.
Obrigada.
Ok, e assim passamos para a parte final do nosso debate em português, com a intervenção de dois portugueses que estão muito ligados às questões internacionais, e perguntava às pessoas que estão nesta sessão, que nos assistem de forma impecável, com os seus vídeos e microfones em baixo, que através do chat, se quiserem colocar alguma questão, disponham. Se não, avançávamos aqui para uma ronda já entre nós, Europa e agora. Patrícia.
Eu posso elaborar um bocadinho mais e novamente volto a dizer que a minha visão é sempre a visão da parte da investigação, que está cada vez, felizmente cada vez em Bruxelas se liga mais. Nós trabalhamos sempre com a DG Santé juntamente nas nossas reuniões, porque isto obviamente só faz sentido se depois as coisas fluírem e tiverem um resultado na implementação e na saúde dos cidadãos, mas a visão é aqui da parte da ciência. Voltando um bocadinho ao que eu estava a dizer, o objetivo neste momento na ciência a nível europeu é colaboração, perceber o que é que está a ser feito em cada país, maximizar, tentar ter processos de desenvolvimento rápidos em que nada falte, incluindo financiamento, seja para vacinas, que obviamente têm uma envergadura em termos de desenvolvimento diferente, seja para uma terapia, seja para um teste, estamos divididos em grupos de trabalho, em cada Estado-membro participa, no sentido de identificar os tais bottlenecks. Trabalhamos com a Agência Europeia do Medicamento, com o ECDC, portanto, com as várias entidades, de acordo com a forma como é adequada para cada subgrupo, no sentido de ter a certeza de que uma boa ideia, uma boa solução, nunca vai ficar perdida e que conseguirá ter um acesso rápido, tanto a nível regulatório, porque é apanhada logo de início, que não morre no financiamento com o famoso vale da morte, e que tem uma rede de ensaios clínicos, de instituições, centros de ensaios, prontos a recebê-la, sem ter que percorrer os tempos normais de espera no desenvolvimento de uma terapia ou de um medical device ou do que seja. Portanto, este é o grande esforço a nível europeu. Depois, obviamente, vão ser abertos mais concursos, vai ser dado mais financiamento, vai ser dado financiamento que se calhar não vai ser todo ele competitivo, como aconteceu já com aquela vacina, a CureVac, a empresa alemã, que já teve 80 milhões de euros. Portanto, o Horizonte 2020 está a chegar ao fim, tem que se pensar nos vários tipos de financiamento que podemos juntar e tentar também capacitar, mobilizar os investimentos nacionais o máximo possível e tentar com que não haja um bocadinho de sobreposição. Portanto, está a ser recolhido tudo o que está a ser feito em cada Estado-membro, no sentido de ter um esforço conjunto para que na área das terapias, vacinas e novos testes nós trabalhemos de forma completamente coordenada a nível europeu e que possamos ter no mercado de forma rápida e garantir o financiamento sempre que necessário destas soluções que vão ser indispensáveis para sairmos, pelo menos nesta primeira onda, mas obviamente a perspectiva é pensar no futuro. Com a óbvia capacitação e trabalho que também decorre ao mesmo tempo em tudo o que tem a ver com o global preparedness, como já falámos, portanto, para um surto novamente deste vírus ou de outros vírus, porque vamos ter que aprender a viver com estas situações e, portanto, capitalizar nos investimentos que estamos a fazer agora.
Certo. Eu tenho aqui um convidado da Argentina, Augusto Iti, que queria fazer um breve comentário. Estou só a lembrar que já estamos mesmo em cima do nosso horário de fecho da hora. Augusto, muito breve. Muito breve.
Paulo, muito obrigado pelo convite. E para nós que estamos nesta parte do mundo, muito interessante escutar vocês, porque vocês estão na frente de nós podemos aprender de vocês os acertos e os erros que todos estamos cometendo nesta pandemia. E então focalizar bem nos acertos e nos erros para tentar, quando isto esteja chegando aqui na Sul-América, aprender e poder prevenir, tanto com os desenvolvimentos do EPP para não depender de ninguém, como os projetos das vacinas. Então, para nós é muito interessante participar en estos eventos europeos y poder prever situaciones que vocês ya algunas pudieron prever, otras no pudieron prever y sobre esos erros nos aprender. Muito obrigado pelo convite.
Ora, muito obrigado, Augusto, e esperamos pela tua presença na próxima semana no Online Summit. Comentários finais em português, queridos convidados?
Posso, muito rapidamente, dizer que foi muito interessante e creio que, por um lado, o que o Gerard agora escreveu no chat, mas que a Patricia Calado também sintetizou muito bem. Eu estou moderadamente otimista porque acredito que parte desta consolidação ou coesão europeia se vai fazer por um lado da ciência, dos cientistas, da investigação, onde as redes estão a funcionar muito mais depressa do que na cooperação política. E há um aspecto muito importante que o Alexandre Lourenço sinalizou, creio que no chat para o Gerard, que tem que ver com a visão estratégica que a Europa tem que ter para não ter dependências vulneráveis de terceiros países. Já alguns países do centro e do norte referiram que a dependência, nomeadamente da China, é um risco em áreas tão sensíveis como a tecnologia, os medical devices e os produtos farmacêuticos. E eu acredito que este movimento pan-europeu de raiz científica e ligado à investigação que está a ser feito, vai permitir também que ao nível político se considere que há reservas estratégicas na abordagem europeia destes aspectos que não podem ficar de fora, têm de ser acauteladas, tendo em vista um novo fenómeno deste, ou uma segunda ou uma terceira vaga. E, portanto, a Europa não pode estar dependente do conhecimento e da produção de conhecimento científico de terceiros, mas também não pode estar dependente da produção de bens e equipamentos necessários que são indispensáveis. E que levou a que tivéssemos visto coisas pouco bonitas, como países a reterem a circulação de bens e serviços, violando os tratados na sua mais básica linearidade propositiva. De maneira que, muito obrigado a todos, gostei muito, parabéns Paulo, foi dos melhores fóruns que aqui tivemos, e uma grande boa sorte para a Patrícia Calado, por pelas razões que falámos no princípio, antes de estarmos em ONU, e a todos, enfim, ao Alexandre, a todos, foi magnífico, uma magnificação. Muito obrigado.
Muito obrigado a todos e sem mais temos que dar por concluído aqui o nosso tempo. Eu agradeço imenso a presença de todos os que estiveram nesta palestra hora do almoço, também na assistência e também a todos os que nos estão a ver pelo Facebook. Muito obrigado a todos e até breve, próxima semana, El Tata Forum Online Summit, a pensar que estamos em Cascais. Boa tarde a todos. Obrigado.